she had every reason to be angry that the healthcare system failed her. We actually talked about that, and I can honestly say there was no anger. And that is pretty incredible when you sit back and think about it.
That's Kim Harris talking about her friend of 40 years, Tanja Harrison. Tanja died last December of breast cancer. 3 years earlier, the 53-year-old wife and mother was told she had dense breasts after a routine mammogram. It can be difficult for mammograms to pick up cancers in people with dense breasts because dense breast tissue and abnormal breast changes, such as tumors, both show up as white areas on the imaging. Harrison asked for supplemental screening, like an MRI or ultrasound, but was denied. The former university librarian felt if she had received it, she may have had a chance to fight for remission. Advocates say her story is an example of why supplemental screening should become a standard for women with dense breasts. Here's why. Ultrasounds and MRIs can pick up things a mammogram cannot because they're more detailed. In Nova Scotia, patients who have a greater than 25% lifetime risk of breast cancer can access mammography and supplemental MRI screening. Factors that increase someone's risk of breast cancer include family health history, whether a patient carries a certain gene, and breast density. But Jenny Dale of the advocacy group Dense Breast Canada says simply having dense breasts should be enough for those patients to get supplemental screening. She says mammography misses about 40% of cancers in women with dense breasts.
And so women must get additional screening, and that is what is being denied to them. So they are given a test that is not accurate. They are not told it's not accurate. They are not warned that they need to be vigilant. If they see anything, feel anything, they need to be their own advocate.
There is currently no organized breast cancer screening program in Canada that offers supplemental screening to women with dense breasts. But some regions are moving towards offering the screening outside of those programs with a doctor's referral. Alberta says doctors should consider an annual breast ultrasound for women with extremely dense breasts on a case-by-case basis. The Northwest Territories says it aligns with Alberta's best practices. British Columbia says ultrasounds are available with a referral. And in Ontario, people with extremely dense breasts can talk to their doctor about being referred for additional screening. In 2023, an Ontario Health Committee recommended publicly funding supplemental screening as an adjunct to mammography for people with extremely dense breasts. The province's Ministry of Health is currently reviewing the recommendation. Dr. Jean Seeley of the Ottawa Hospital was an advisor to the committee. She says although providing supplemental screening comes with a big price tag, providing care to patients with later stage breast cancer through treatments like radiation and chemotherapy is more costly.
So it is worthwhile to be able to diagnose women with dense breast with early stage breast cancer because it's not only good for them, they're more likely to survive and do well. They also require far less treatment costs.
Tanja spent some of her final days fighting for women with dense breasts to have the option of supplemental screening. And her friend Kim says she feels a duty to carry on her advocacy.
She was very spiritual. We would joke about, the tricky universe sending us messages. 15 minutes after she passed, I got a very, very strong sign from her. I just know. I just know that this meant a lot to her.
Thomson, CBC News, Halifax.